So welcome everyone. Thank you for joining us today. If you're joining us on YouTube, thanks for stopping by. We'd appreciate it if you would subscribe to our channel for more videos on all things aphasia. This is Ask the Expert with Jenni Rook, who will be talking with us today about how our brains process and respond to music and how music therapy can be used to improve verbal communication. I'll be your moderator for this hour-long session. My name is Jen. I'm part of the team at the National Aphasia Association, a nonprofit organization that provides access to research, education, rehabilitation, therapeutic, and advocacy services to individuals with aphasia and their care partners. On today's agenda, we'll be hearing from Jenni Rook, then we'll open up the floor to those in our live audience for questions. And now I am honored to introduce our panelist, Jenni Rook. Jenni is the Executive Director of the Institute for Therapy through the Arts and a board-certified music therapist and licensed clinical professional counselor. Jenni has served as the President of the Illinois Association for Music Therapy and is the Communications Coordinator on the board of the National Coalition for the Creative Arts Therapies Associations. Jenni, thank you so much for being a part of our series today.
Thank you for having me. I'm so thrilled to be here.
So I'm going to hand it off to Jenni, but again, if you have any questions, please put them in the Q&A chat.
Thank you. Well, I'm thrilled to be here tonight talking to you about music therapy and aphasia, and looking forward to hearing from you and answering your questions later on. So I'm going to share my screen and just put up a couple of slides, but I'll switch between sharing and unsharing, so you can just kind of see some of this here. But I have worked for 17 years as a music therapist, and I've actually worked at the Institute for Therapy through the Arts that entire time. I have experience working with people who have had aphasia, brain injury, say have aphasia because of a brain injury or a stroke. I worked for 6 years as I was working at ITA. We had a partnership with the Rehab Institute of Chicago. They're now known as the Shirley Ryan Ability Lab, and they're one of the top rehab hospitals in the country. And there I had the opportunity to work side by side with speech therapists, but also independently with patients, again, who had brain injury, stroke, and had a language disorder that developed because of that. Also worked with individuals who had spinal cord injuries, Parkinson's disease, orthopedic injuries, pediatric and adult patients. And then in our clinic at ITA, that we go by ITA, I've seen people who have had a stroke and have aphasia, and they've come to us for music therapy a year or two after their stroke. And we have seen pretty good progress, significant progress, even that long after they had their incident. So that has been my experience working with this population. It's some of my favorite work to do, so I'm looking forward to talking to you about it tonight. The organization I work for is a nonprofit, ITA. It's based just north of Chicago in Evanston, and we have another clinic in Highland Park, if you're familiar with the area. We've been around since 1975, and we actually have art, music, dance, and drama therapy at our center. We're in about 50 different locations throughout the state of Illinois. Mostly in the Chicagoland area, but that's through partnerships, like I mentioned, with the rehab hospital or schools, nursing homes. So we see a wide variety of individuals, all ages, and that's kind of how it works with music therapy. So we'll talk more specifically about that one, but I'll share more information about us later on too. Music therapy works with a wide range of people. It could be individuals like the child that's pictured here who have some form of developmental disability, maybe physical limitations that come from that and communication issues. We also see people who have mental health concerns. So it could be anxiety, depression, trauma. Older adults, people who have started to have experienced a decline in their cognition due to memory loss or dementia. And we see all ages. Music therapy is really accessible. It's easy for people to engage in, even if they haven't had any previous experience with music. They don't need to be musicians to benefit. And we're helping people to regain skills that they have lost, to develop skills that they don't have yet, to cope with things that are challenging for them. So we're trained really broadly in this field. I have a specialty in neurologic music therapy, which looks specifically at how music is processed in the brain, how music can make lasting changes in the brain. And the research has broken down music into its various elements like pitch, rhythm, melody, harmony. And that really helps us to isolate those principles of music and use them therapeutically, because we know the reactions that the brain is going to have when we use those specific elements of music and kind of reorganize them. So I hope to talk to you tonight about how music therapy works and give you some examples of what music therapy looks like with people who have aphasia. What you're looking at here are several different views of the brain. And this comes from a study where researchers looked at individuals as they were listening to a piece of music. In this case, the music was a tango, but it would be pretty similar no matter what type of music they were listening to. And know that they were just listening to the music. They were not playing an instrument or singing, anything like that. So it was just kind of passively taking the music in. And the different colors that you see represent the level of activity the brain was engaged in while these people were listening to music. So some high activity, some low activity. But what you'll notice is that music is really represented throughout almost the entire brain, right? You don't just see a couple of centers lighting up, you really see even disbursement of how music is processed. So I show you this tonight to make a point that for a lot of functions that we carry out in our day-to-day lives, there are centers of the brain that are primarily responsible for those functions happening. We have the motor cortex responsible for movement. We have the speech centers of the brain. And of course, there are more than one area that are responsible for these things. But with music, you really see the entire brain engaged. And this, again, is just in processing the music. We would see even more brain activity here if the individual was playing an instrument or singing or even moving to music like dancing. So there isn't a single music center of the brain. This is significant for music therapy because what it means is that in order for us to make music or process music, the pathways have to be shared with pathways that carry out other functions. So for instance, those same pathways that are activated and are used to send signals to our bodies are being used to process music. So we're sharing pathways, motor pathways, we're sharing the same pathways that are used for speech and communication. We're sharing pathways for memory, for emotional responses. So what this means in therapy is that music can access all of those different parts of the brain. And when an area of the brain has been damaged, it could mean that music is actually bypassing those damaged areas and can help recruit new areas of the brain to learn how to carry out a function that the damaged area was previously responsible for. So you're probably familiar with the concept of neuroplasticity. And what the research is showing us is that music can actually enhance the process of neuroplasticity. It's easier for us to learn information and to retrain our brain to do things when we have music present. I'm going to unshare just for a second here because there's really nothing to look at. But what I want to tell you now is a few more principles that kind of underlie music therapy and why music therapy works and what we know from the research in the field. One thing that's prominent in Western culture is the sense of a tonal center. So we are really used to music sounding a certain way. It usually is clean, it ends on a certain type of pitch. Melodies usually resolve themselves. Think of the contrast of some Eastern music or more of the New Age music that you hear people listening to, where it could be more droning. You can't really tell where the melody is going to go next. And that's actually really great for relaxation. But for most of us who maybe grew up here, we are really used to music being pretty predictable. And so I'm going to say we a lot. And what I really mean is our brains are used to music and melodies doing certain things. So I'm going to sing an example for you. If I sing la, 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 I'm going to guess that you are singing a pitch in your head. And I'm going to guess that that note is la. Now you might say, sure, that was just a descending major scale going so, fa, mi, re, do. And we're probably really familiar with that, right? So it's kind of a familiar melody, but we're resolving on that do. You don't hear melodies that stay on that re. right? La, 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 la. It sounds incomplete, and it sounds incomplete because that's just not the way melodies are structured in Western culture. But what it does neurologically for us is it creates a feeling of suspension. There's this anticipation that we experience, and our brains are compelled to resolve that melody. So we start to do it internally in our minds. But we use this principle in music therapy because this actually can encourage verbalization. And I've used this with people who have autism, with people who have aphasia, of course, but other people who are maybe coming out of a coma, who have a brain injury, who are really just working on getting some verbal communication out. So again, relying on that principle of anticipation and the fact that we kind of know how we want music to sound. Now, if I sing this melody, let's see if you can tell me what note comes next. La, 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 la. I'm going to guess the note that's in your head is la. It's actually the same pitch that we just sang before. But that melody danced around a bit. It wasn't familiar to you, right? It was just something I made up, but yet we know how we want that melody to end. So when I am using You Are My Sunshine with my clients, I'm going to sing the phrase, please don't take my sunshine off. And they're going to sing way. And I intentionally end that phrase, or I leave that pause right after the because the melody is going to resolve on the way. So music therapists know how to use melodies as cues, how to structure those fill in the blank moments to really make it optimal for the person to speak, because the brain is going to be most compelled to jump in and finish what isn't resolved yet. I would never stop at please don't take and expect my client to sing My Sunshine. It just doesn't have the same pull that an unresolved melody has. So there's an intervention we use called MuStim, musical speech stimulation. And this works really well for people who are just kind of working on getting some of those words out, maybe for the first time since a brain injury. I also want to talk to you about music and memory, because that's a really significant relationship. It's really important for us to use music and music therapy that's familiar to our clients. And so we'll talk more about that in a second. But for example, think about how you learned your ABCs. If you did not learn your ABCs with music, I am very impressed, because I don't know how you could possibly manage to remember such a long sequence of letters in order without there being some help, right? So music acts as a mnemonic device. And that song, the ABC song, which is also the Twinkle Twinkle melody, right, is chunked and organized in a really great way for memorization. You have A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. So there are chunks of letters that are put together, and every chunk sounds a little bit different, right? A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P. And because they each have a unique melody, it becomes easier to remember them. And each melody kind of leads into the next, right? So that's the example I like to use to think about how music therapists write songs for clients when we're trying to help our clients remember information. It's really important that we use that melody in a very intentional way. So I talked about the concept of chunking, because that's the way that our brains like to remember information, and it helps to take a lot of information and simplify it. So think about your phone number. A 10-digit phone number actually becomes 3 chunks when we take the area code, the first 3 digits and the last 4. 847-425-9708 becomes 3 pieces of information for your brain to remember. So we can create content in songs, we can write lyrics, we can help our clients to remember how to do things, to remember information when we take melodies and put them together. I helped a client remember her children's names, and I shouldn't say remember because I think she remembered them very well, but we were working on retrieving them after she had aphasia, and it helped to kind of put a melody together where she could say Ron and Steve, Pam and David, Dan and Nick, and we use that melody to rehearse and to help her speak her children's names in birth order. And so again, a chunk, we put 2 names together, so it became 3 chunks instead of 6 children's names, right? Da 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 da. and then worked on fading that melody out so that she could speak that phrase too. So music and memory very closely linked and comes into play a lot with aphasia because we tap into automatic speech with music. Those things that are overlearned in our brain that are easy to retrieve. And I'm sure you know a lot about this with aphasia, those things that you could say right away after you had aphasia, sometimes, you know, counting, swear words, but song lyrics are there too. And so that's a great way to just start to get communication out. The other intervention you've probably heard of before is melodic intonation therapy. And this is used by speech therapists and music therapists for people who have certain types of aphasia. So it doesn't work for everybody, but it's better for people who have certain types of expressive aphasia. There also has to be some other things, and we can talk about that in the Q&A if you want, about what makes a good candidate for melodic intonation therapy. But this is the process where we take functional phrases that somebody needs to learn to speak again, and usually they're personal to the person I'm working with, and we put them to melodies. And then the goal is to get rid of the melody so that the person can speak the phrases without it. But because we know that people with expressive aphasia can generally sing when they can't talk, not everybody, but we see that a lot, that people can sing. We use that strength, that musical strength, and we take the phrase, we put it to a melody, we overlearn it, we rehearse it, lots of repetition, and then eventually go into a call and response where I'm asking a question and they are able to answer my question with that phrase. So I'm just going to show you a quick demonstration of what that looked like for one of my clients. And I fortunately am not able to have this up beforehand. There we go. All right, so this is a client who had a stroke at the age of, I believe, 55, and he is a huge Cubs fan. And this is him talking about his appreciation for the Chicago Cubs.
So nothing is, I'm not sure if it's playing on your end, but nothing's playing through our audio.
Oh no, can you see the visual or just not the audio?
No, we can't see audio or visual.
Oh, sorry, okay. Let me try that one more time and then I'll just give up on it if it doesn't work. Were you able to see the PowerPoint at all?
We saw the PowerPoint,
Okay.
and then you took it down and we haven't seen it in a while.
Okay, sorry about that. Let me try one more time. Different way this time. Are you able to see that?
Yes, so now we can see it.
Okay, try it.
We cannot hear it though.
All right, sorry about that.
There's a, I don't know if you clicked the optimize for sound button when you did the screen share.
Nope, let me do that. I'm sorry about that. Sorry, everybody. Yep, I have to share the sound. All right, I will give it one more try and then I'll give up on this. And are you seeing it now?
I can see it.
All right, let's try.
Yep, great, thanks.
Awesome.
Yes, I do. Yes, I do.
Wait 1 second, we're gonna put a little pause in between, okay?
Yes, I do. Yes, I do.
Stop. Dan, do you like the Cubs?
Yes.
Yes, I do, okay? Do you like the Cubs? Yes,
Yes.
I do. Okay, you try answering that. Do you like the Cubs?
Yes, I do.
Good. Do you like the Cubs?
Yes, I do.
Good job, Dan. That was awesome.
Wow,
Nice
nice.
job.
So that was very early on in music therapy for this client. So we were really just trying to get full sentences out. Yes, I do wasn't the most priority phrase he needed to speak, but it was something that he could latch onto right away and start to have some success with. So you see how this is also after he has done a few melodic intonation therapy sessions, he learned the phrase, he could intonate and intonate it independently after repeating after me, and then was able to respond to a question. And so then we're able to take the music away and he can speak that phrase. With melodic intonation therapy, one thing to keep in mind is what happens when you do this work is you're learning a set of sentences or phrases with your therapist, but that doesn't mean those are the only sentences you're going to be able to speak. So in this instance, when I met this client, he had 2 phrases that he could speak. And after 2 years, he was at 60 phrases. But not all of those were ones that I taught him. It came to be that he was then spontaneously speaking other phrases that we had not worked on. So you could see that neuroplasticity was in action, new pathways were being laid for communication, and it was obviously extending outside of our sessions. And again, I saw him 1 year after stroke, and he only had 2 phrases. This person has global aphasia, but was a great candidate for melodic intonation therapy because of some of the other factors that were characteristic of his communication. And I just wanted to touch on apraxia quickly before we get into some questions, because as you know, apraxia is present very often when people have aphasia, and it affects the ability to articulate sounds clearly. So we see people that mean to say one sound, but something else comes out. They may add in syllables when they're talking or omit certain sounds. So with apraxia in music therapy, we really rely on rhythm. And I'm just going to give you an example of how rhythm and beat interact with the brain. But when you hear a steady beat, so it could be a song that has a steady beat in it. And of course, every song has a beat, but sometimes the beat is more prominent in the song. Or even if you just hear a beat without any music, and it could be a metronome. And we use a metronome very often in music therapy, especially because it keeps us honest. Humans make error, and a metronome is going to be really consistent. So when you hear a beat, your brains start to synchronize with this beat. And going back to that example that I gave you in the beginning about the study where people were listening to the tango, if you want to Google the tango brain, there hopefully is still a YouTube video up that actually shows you what it looked like when they took these scans and they compiled them all together in a 3-dimensional brain to show you what it could look like in real time as someone was listening to this music. And you see the brain start to dance with the music. I mean, it lights up exactly in time and in synchronicity with the beat. So check it out if you want to, but it shows you exactly how neurons are firing at the exact same time that you hear this beat. So the sound travels through your ears, it hits the auditory cortex. The auditory cortex is very close to the motor cortex, and the motor cortex is controlling our movements. So all of the sudden, very quickly, the motor cortex is sending signals to your muscles, telling them to move, 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 and move in time with that beat. So this is why you might find yourself tapping your toe, nodding your head, maybe swaying from side to side when you're listening to music. It's an involuntary response. So think about when I talked about that suspension and melody, how we're kind of relying on those almost like involuntary reactions that we have to music, that things that just kind of automatically happen. This is another one, right? So that's why we use music, because it tends to make things a little bit easier. So your muscles are primed to move when you have that steady beat. And you have all of these muscles in your mouth, your lips, your tongue, and these are our articulators, right? This is what helps us to communicate and produce different sounds. So that rhythm is really going to organize the movement of these muscles, and it's going to help coordinate everything. We slow things down. So we do this with sentences. There's an approach called rhythmic speech cueing, where we'll take a sentence and we'll put it to a beat, and a lot of repetition, a lot of visual modeling from the therapist. But we also do this with music. There's an approach we use called OMREX, oral, motor, respiratory exercises. And this is specifically targeting articulation for people with apraxia and dysarthria as well. And we use songs that have a lot of repetition, alliteration, but especially when we want to target a certain phoneme, so like a sound that someone's having a hard time with, we'll choose a song accordingly and use it as an exercise. So for instance, I would use the song Hey Jude. If someone knows that song, if they're the right age demographic for that song, because we do want it to be familiar. But if they're working on that N sound, I'm going to take the bridge of that song and we're going to sing na, 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 hey Jude. We're going to slow it way down. We're going to put it to a beat because we're going to use that rhythm to help us. Na, 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 right? Nice and slow. So I've seen a lot of success. We overdo it, we repeat it, and we really start to cement those neural connections so the brain can remember them and remember how to organize the muscles to produce that sound. So the last thing I want to say about the interventions that we use in music therapy is that if you enjoy them, they work better. Music therapy isn't always fun, believe it or not. Sometimes my clients are like, again, I have to do it again. But we really want those wonderful neurochemicals to come out. And your brain is going to release a lot of really great neurochemicals just by listening to music. You're going to have oxytocin, you're going to have dopamine produced. But if you enjoy it, even more dopamine is going to be produced. And dopamine is one of those magical neurochemicals that when we're working with neuroplasticity and we're trying to create new brain maps, it sort of cements those connections. So those chemicals kind of, a music therapist one time called it a bath for the brain, and really kind of wrapping around everything and helping the brain to remember exactly how it did something. So we laugh, we have fun, we enjoy it, we smile, and try to make sure that all those really good neurochemicals are being produced at the same time. So I'm happy to answer questions. I'm also happy to talk about things that you can do on your own, and that might come up in the questions, but that's something we can chat about, is what you can do in the absence of a music therapist. But I'll turn it over to questions now. Thank you.
Jenni, thank you so much for sharing. It was lovely to learn more about what you do and more about how the brain reacts to music. And it was especially nice to get a little Beatles concert in there. So just as a quick reminder to our live audience, if you have any questions, please enter them into the Q&A chat. Again, if you look at the bottom of your screen, you should see a button that says Q&A. So I'm going to start us off with some pre-submitted questions. So you talked a little bit about how music therapy is helpful with melodies based on Western melodies and Western music. Does this mean that music therapy changes in different cultures and different countries?
Absolutely, yes. I'll give you an example with aphasia, for instance. There's been studies on melodic intonation therapy because there's two big principles that are used in melodic intonation therapy. And one is the rhythm, because there's some hand tapping that's involved in that approach. And it is a bit rhythmic when we do it. And the other is the melody. And what they found in people who are from different countries, it sort of depends on how rhythmic and melodic their language is and how their brains are actually utilizing those two different musical elements. So in France, for instance, it's a more melodic language without a lot of rhythm in it. And so the melody was much more important in melodic intonation therapy, where in German, it was much more rhythmic. So that's one example. Culturally, you really have to think about people's experiences because memory plays a role. Our relationship with music has so many different emotional responses based on the associations that we make with music. So in music therapy in particular, if I'm working with clients here who are from different cultures, from different countries, I really have to get to know their music and also how it's performed, their instruments, and really be able to kind of recreate what it is that they connect with. So absolutely, music therapy is practiced differently in different countries, and you will see similarities. You know, some of these interventions are practiced across the world, and And there's also a lot of variation too.
Great. I'm actually going to go to a live question now. Sorry, just one moment. I'll ask the question. Since my stroke, I enjoy listening to music much more than before. What could be the explanation for that?
I don't know why you would enjoy listening to music more. It could be that maybe you are feeling things a little bit differently than your stroke. I mean, kind of everything can change, right, after a stroke. So it might be that your brain is just responding a little bit more, like those neurochemicals are a little more activated since your stroke. It may be that it's depending on, aphasia and how it's presenting with you. It may be that you are just able to connect with it more, maybe than other things that are happening in your world.
Great. And our next question is also a live question. I would love to hear about things to do on my own. Thank you.
Absolutely. Sing, please sing. It's so important. It doesn't matter what it sounds like. You can sing along with songs that are familiar to you. If you're able to somehow slow them down, that's wonderful. Sing with a partner when you can, because that monitoring is really important. And so if there's anybody who can sing with you and maybe help you when a word isn't produced the right way, sing for your enjoyment, but if you're also singing to try to help improve your speech, it can be really helpful when someone's there to correct something that you do that might not be right, because we want our brains to learn how to do things the right way. Think about music that has lyrics that maybe you are successful with already. So you're not singing, words that are more challenging for you to produce. Repetition is always really good. Music that you like is really important, like we talked about with that dopamine production. Yeah, sing, sing, sing. Some of the things that I just talked about with using some of those exercises, depending on what it is that is challenging for you. You can try some music with a lot of repetition in it of syllables, like that na 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 and Hey Jude. That's really great. The other thing I'll say is if you can move with the music, you're going to have more success. So if you're in my music therapy sessions, a lot of times we're like conducting, moving our arms, engaging our bodies. The more of our brains that we can activate in the process, the more successful it's going to be. So if you feel weird dancing, you don't have to do that. But if you can maybe conduct, even if you can walk in rhythm with the music, that could be really helpful too. So just think about how you can make that more of a whole brain process. And so maybe engage more of the body to engage more of the brain.
Thank you. And while we're on this topic, is musical therapy something communication partners can work on with their family members? If so, what advice do you have for care partners?
Absolutely. Yeah. Just like I was saying, someone that's there to kind of monitor. And if someone can sing with you and be that visual model to sit across from you and sing a song with you and give you some of those cues that are going to make you more successful, that's a really great thing to do. It's also just a really nice way to connect with your family members. If you're, comfortable holding hands or touching each other and you can both kind of tap together with the music or, swing your arms back and forth. Again, some movement that can be involved in that experience is great too.
Great, thank you. So our next live question is, I love the Hey Jude example, which directly targets the phoneme na. Is it ever appropriate or helpful to insert other phonemes that need to be practiced into a song, even if the original song does not have the phoneme? For example, could I use da in the section of Hey Jude, or would that be neurologically confusing for the client?
That's a great question. It has been confusing for my clients sometimes, especially because I'm really relying on that memory as a strength. And it can be hard to switch up something that someone already has a memory for. It also can work. So I have tested the waters with that and just kind of feel it out. If it's successful, then we will go with it. But I always have in the back of my mind that it can be really, we call it piggybacking in music therapy, when you take a melody from something and you change the words or you change the sounds in it. It can be tricky with people who have aphasia. you want me to read that one, Jen, that question?
I'm sorry, I was on mute.
Oh, that's okay.
So the question, I read the whole question before I realized. So in what state of stroke recovery, for example, acute, subacute, chronic, is music therapy most helpful?
Just like all therapies, the sooner the better.
Is there a difference between a music therapist and a speech language therapist who uses music therapy? How do I choose who is right for me?
That's a fantastic question. If you actually have found a speech therapist who is a music therapist, which would be the only way they could do music therapy, that is wonderful. I know some of them. That would be great. But we are very different. The speech therapist is an expert in communication and all things related to communication, the anatomy that comes with that. We are experts in music. And specifically how music can be used to help people. That's the training that music therapists have. So we have that in-depth knowledge of how the music interacts with the brains, how people respond to music behaviorally and emotionally. The ideal situation is always that we work together. I rely on speech therapists to help me identify what the problem is because I can't diagnose somebody. So I think especially if you're in earlier stages, then you want to make sure you have a speech therapist who can really make sure that you understand, they can communicate to you what it is that's going on. Speech therapists are great then about setting that treatment plan too. The music therapists kind of take that information. So I will look at reports, I will look at MRI reports, I will look at reports from speech therapists or any other therapy that my clients have done. And once I understand kind of what the issues are, then I know how music can help. So they're both great. I think if you have a speech therapist that's willing to incorporate music, that's really wonderful. And if you have a music therapist, they're probably going to refer you to a speech therapist unless you feel like you've kind of gotten all you can out of that. But I know I'm always, if I'm working with a client that has aphasia, I'm going to ask them to be in speech therapy too.
How do I find a therapist who works with music therapy? We also have this as a live question. The live version is, how do you find a good music therapist in the area you live in? And also, is it better in person or can it be done over Zoom?
Yes, I actually have a slide that I forgot to put up, and I'll show you if can I still share a screen? Sorry. Technology today. Okay, there we go. So if you go to cbmt.org, this is the website for board certified music therapists. This is the certification board that actually gives us our MTBC credential. So a music therapist that is completely trained, has done their internship, and has taken the test to become credentialed is going to have the MT-BC credential. And so this is how you find people that are certified. So I just circled the find a therapist section here. It's right on the homepage of their website. And you can go here and you can type in your location and find somebody in your area. You absolutely want to make sure that they have worked with people who have aphasia before. The other place you can go is our website at itachicago.org. We are always happy to help. We have a network of music therapists. We're always happy to reach out to people that we know that might be in your area. We do in-person therapy, but we do also provide telehealth. So this can work over Zoom. I'm doing it over Zoom now. It's not the same. It is much better in person. So if you can find somebody local who can meet with you individually in person, that is the ideal. But yes, it can be effective over Zoom too.
I just want to let everyone in our audience know that I've put that link in the chat box, so you can copy and paste there or directly click on it from the chat box. Okay, let's see. Is music therapy more appropriate for certain types of aphasia?
Music therapy can work with nearly all types of aphasia. Not all of these interventions will work with all types of aphasia. There's less research out there for people with receptive aphasia and Wernicke's aphasia. There's less research in music therapy supporting that. But I personally have worked with people with all different types of aphasia. And there are things that we can do to just get communication out and to get communication more, I should say verbal communication more accurate, and to work on comprehension, which is something I didn't really talk about, but to make sure that they're understanding what it is that they're hearing. But definitely more research out there for expressive aphasia.
Kind of along the same lines, we had this question come in. My family member was diagnosed with primary progressive aphasia 5+ years ago. Recently, this family member has stopped communicating, even with family member names. Would music therapy be appropriate?
Yeah, music therapy is always good to try. There's just a lot that we see happen when music is present that we don't see when music is there. And so, especially with primary progressive aphasia and relying on memory, people with primary progressive aphasia oftentimes have dementia too. And so when there's that strong link between memory and music, what they found in people that have dementia is that music is one of the last things to go, right? So we could still rely on that strength. Those musical memories are still there. So absolutely, you can try music therapy. Also, just bringing music into their lives as much as possible. You want to use music that was really popular in like their transformative years. So we usually say around the ages like between 18 and 20, music that they remember from that time period is going to be stored really strongly in their memory, because those are usually pretty emotional times in our lives, and emotional memories are stored very strongly in our brains. So that's something to think about in terms of things that you can do on your own, is selecting music that'll be really strongly linked to emotion for them. But yes, we had a primary progressive aphasia choir actually. So it was really just a chance to practice. It was probably more practicing than it was music therapy, but to sing in a group and just really, we really just want to try to maintain as much as possible with primary progressive aphasia.
How can someone join that choir?
We don't have it anymore, unfortunately.
Oh.
Yeah.
Our next question is a longer one. So Nina Kraus at Northwestern University wrote a book titled Of Sound Mind, How Our Brain Constructs a Meaningful Sonic World, where she explores the power of music for healing, as well as the destructive power of noise on our nervous system. Whoops. So have you read this book or others by Nina Kraus? And do you have any book recommendations for persons with aphasia or their care partners?
I know Nina Kraus. I'm actually presenting with her next Thursday at Northwestern. I'm looking forward to speaking with her. I am in chapter 2 of her book. I'm chipping away at it slowly. And I'm excited to read the rest. I've heard wonderful things. So yes, I think that would be a great read. Although I haven't gotten far along in it enough to, I think, make a good recommendation, but I think she's phenomenal and she's done incredible research. So I would recommend anything that she does. If you read any Daniel Levitin, in terms of just music in the brain, the book, This Is Your Brain on Music, it's a little bit older, but it's an excellent, it does get a little dense, but it's just an excellent explanation of all of the many ways that music impacts us. This is not music specific, but I love the book, The Brain That Changes Itself. It's another great one. And I'm gonna have to think on this one a little bit more.
Sorry, I didn't get the second one you said. It was the music.
Oh, The Brain That Changes Itself.
The Brain That Changes Itself. And I'm putting that in the chat for anyone who would like to copy and paste it into Google. So we do get this question quite often. Will my life be normal again?
I think we are all constantly redefining what normal is, right? That's a hard question. Everything changes. I'm not sure, I have an answer to that question. I don't know, the people that I've worked with, I don't know if they find that normal or they find a new normal that works for them. Because a lot changes, relationships change. Obviously communication is going to be different. So I don't have a great answer for that question, but I just want to say that I hear what's underneath that question, and it's really, really hard.
Thank you. So I know you talked about this a little bit, but is there a point where someone should pivot away from therapy? Maybe like if somebody's plateaued with their therapy?
Definitely. I've had these hard conversations with families before. Really, it's more come from, I think, a place where the client and their family has gotten to a point where they're just tired. So it's not because of lack of progress, but it was lack of practice. So with these therapies, you can't just do music therapy 1 or 2 times a week and see results. You have to do a lot of homework, and there has to be a lot of reinforcement for what it is that you're working on. And oftentimes you need a partner to do that with you. And unfortunately, what I'll see from families is they're really excited, they're engaged. I have family members in the sessions with me, I should say that too, so they can see exactly how I'm teaching my client something, and then they can practice that at home. And I will assign homework every week for them. We have workbooks that they take home, sometimes videos of me singing, or just recordings that they can listen to. So I try to give them as many tools as I can to do this work on their own. And I think that just gets hard to keep up with for the person with aphasia and with their families. And those are the times where I've seen plateaus, actually, when there's just not as much that they can do on their own. And so I've had those conversations where I tell families, like, if you aren't able to find time to do this, then I'm not sure therapy is going to be as effective anymore.
Great, thank you. We have one last question. What is one message or piece of advice you would give to all people with aphasia?
I think I would say do what makes you happy. And if you can find happiness in music, then absolutely engage with it as much as you can. It's never going to be a bad thing. But there are so many things that are challenging. Find those things that bring you joy, because that's, staying happy is really good for the brain for a lot of reasons, not just for communication. Our mindset is so important to try to stay positive as much as possible. And I've just seen incredible resilience and attitudes in the people that I've worked with that I'm really inspired by. And the people who are most successful are those that can find a way to find joy in their lives and hope.
Thank you. Thank you so much. Thank you for all the work that you've done and for spending time with us today. I could listen to you talk and sing for another hour. Unfortunately, we're getting close to the end of our session. I want to thank you for being here with us today, and then to our amazing audience, thank you so much for joining us and sending over such compelling questions. If your questions were not answered today, please, we will probably be bringing it up at another Ask the Expert, so please come visit us again. Our next Ask the Expert, let me actually share my screen again. Okay, so our next Ask the Expert is on March 31st, and that's going to be a conversation with Michael Obel-Omia about his book, Finding My Words, Aphasia Poetry. On April 14th, we will be having a conversation with Dr. Howard Kirshner, a board-certified behavioral and vascular neurologist and a professor of neurology at Vanderbilt University Medical Center, about cognition. And then, let me see if I can move this. On May 12th, a conversation with Sharon and Antonucci about animal-assisted interventions. So I will definitely be bringing my dog to that one. We also have many online groups, a few new ones that we're starting this year. As usual, we have our Books Us and More book club that meets every Thursday. We are currently reading The Guernsey Literary and Potato Peel Pie Society. We've also started a Spanish book club that meets every Tuesday. We have Black American Aphasia Conversation Group, and that's a bi-weekly conversation group that discusses the unique challenges and gifts that Black Americans with aphasia share from experiences with disability and race. We have Professionals with Aphasia Connect, which is a peer-led conversation group for professionals with aphasia. some of our new groups include Journey Through Aphasia, which is a monthly peer-led conversation group to discuss all things related to travel. So if you have the travel bug from being stuck at home for 2 years because of the pandemic, I really encourage you to come join us at Journey Through Aphasia. Finally, we're starting our Parenting with Aphasia group, and this is a monthly group that invites parents with kids of all ages to join together and share experiences about parenting with aphasia. This group is hosted by the speech language pathologist Lauren Schwabish, who is a speech language pathologist at Neurospeech Services in Northern Virginia. If you'd like to learn more about her private practice, you could always visit her at www.neurospeechservices.com. And if you would like information on any of these future events, visit us at aphasia.org/online-events. For more information on the Institute for Therapy Through the Arts, visit itachicago.org. And as usual, if you have any comments, questions, or suggestions, please feel free to email me at jen@aphasia.org. Thank you everyone so much for joining. We love having you here. It's always nice learning together. We hope to see you at the next one. Bye everyone.